Now, in our previous movement videos, we talked about why movement matters, why capacity matters, and why many women with lipedema may also have overlapping factors that change how exercise feels. So the next step is not finding the perfect workout, but it is learning how to build a movement approach that is actually sustainable for your body. And that actually starts with understanding that movement tolerance is highly individual. Two women with lipedema may respond very differently to the same program. And while one may feel energized, another might feel swollen, painful, or even wiped out for a few days. And this doesn't automatically mean that one person is trying harder or doing better. It does mean that our bodies respond very differently. Now, many women do better by starting with movement that they can recover from consistently. And that might look like walking, short strength sessions, pull movement, mobility work, gentle cycling, and even frequent movement breaks. Then capacity can build gradually. It's important to know that progress doesn't always look like building muscle. Progress initially might look like recovering faster, less heaviness after a workout, better stamina, more confidence, improved consistency, and less fear around movement. It regularly causes concerning symptoms, significant pain, dizziness, instability, or worsening of swelling. It may be helpful to work with a qualified healthcare professional or movement specialist who understands your body's needs. And this right here is exactly why your phase of mobility matters. Because if you are in an immobility phase, your focus is on restoring circulation, improving joint integrity, and reestablishing neuromuscular connection. Movement during this phase is often controlled, seated, or supine, and designed to build tolerance rather than fatigue. And if you are in a low mobility phase, you can begin incorporating more structured standing movement and light resistance. Now, if you are in a low mobility phase, you can begin incorporating more structured standing movement and light resistance. The goal becomes building endurance and coordination without creating excessive inflammatory output. Now, in a moderate strength phase, progressive resistance training becomes appropriate. Muscle mass improves insulin sensitivity and supports long-term metabolic regulation. However, progression must still allow for adequate recovery. And in an advanced phase, higher loads and more complex movement patterns may be tolerated, but recovery remains a very critical variable. Now we layer in your current stage. As stage influences tissue characteristics, stage 1 tissue often tolerates progressive loading sooner because fibrosis is less pronounced. Stage 2 may require slower progression and more structured recovery. Stage 3 often involves greater mechanical strain and often requires a longer regulation phase before increasing intensity. Stage 4, or lipolipedema, frequently requires prioritizing fluid management and stability before progressing resistance. This means that both stage and mobility phase must be considered together. Someone in stage 3 who is also in an immobility phase requires a very different approach than someone in stage 1 who has already built a moderate strength foundation. And this is why training must match the internal capacity. Because when intensity is appropriately matched, muscle engagement improves, circulation improves, and the body adapts in a productive direction. But when intensity is excessive for the current state of the tissue, recovery becomes impaired and symptoms may increase. And this is why movement with lipedema cannot be random. It has to be structured, phased, and responsive to the body's current condition. And with lipedema, that is the difference between exercising and programming.